Hello and welcome to yet another edition of COVID-19. Authorities have announced a record number of daily infections on this Friday and concerns are mounting. As pundits point out, the latest tally has yet to reflect the post-Chuseok repercussions. Now, we have more on this alarming spread as well as calls for booster shots later on in the program. Here first are the latest global pandemic tallies with our Kwon So-ah. Now, So-ah, let's start with Korea's fresh high then.
Right, Sunny. The concerns and warnings by health experts seem to have materialized. So 2,434 infections were tallied as of 12 a.m. this Friday. And with an unchanged number of imported cases, the number of domestic transmissions alone stands at above 2,400. With that, Korea has accumulated 295,132 infections. And with 7 additional fatalities, the death toll stands at 2,434, which happens to be the same number as today's caseload. Now, Friday's tally is the highest ever in around 1 year and 8 months since the first case has broken out here in Korea, and and it's even 213 higher than the last record that we had on August 11th. Now, if we go over to our graph, after we had 3 days straight at a little above 1,700, we're seeing this surge of 719 cases compared to yesterday, and even compared to last Friday. This is quite a jump. And this Friday is just the second day we are back from the Chuseok holidays, meaning numbers could rise even further. And the highest factors of concerns are currently the highly transmissible Delta variant. There's also around 40% of cases currently are untraceable infections. And another concern is that the number of cases in the capital region may spread to non-capital places. Now, 72.3% as of 12 a.m. Of domestic transmissions have occurred in the metropolitan region, but that may change in the near future. If you go over to our map, the capital Seoul reported 907 new infections, which is the highest ever daily caseload the city has reported so far since the pandemic broke out. And the same goes for Gyeonggi-do province with 708. Incheon reported 140 infections, and a triple-digit figure here in Daegu. This caseload has doubled compared to the day before. And all we can hope is now for more vaccinations. So let's check on the figures here. 72.3% of the nation's population has now received at least one shot of COVID-19 vaccine, while 44% have been fully vaccinated, around 22.5 million. Let's get a quick view on infections abroad. With over 516,000 infections reported in the past 24 hours as of noon Korea time, the total stands at above 231.3 million, with a little less than 10,000 new COVID-19 fatalities. And let's move over to some specific countries now on our next table. Indonesia has hit 4.2 million cases, Mexico 3.6 million, and Poland has just surpassed 2.9 million cases in total. Those are the general updates I have for now, but I'll see you back in a bit. Sunny?
All right, so thank you for now. Right, meanwhile, as mentioned quite a few times on the program, the psychological impact of the pandemic continues to affect public well-being. And for more on this reality, I have Kim Seung-yeon here in the studio with me. Seung-yeon, good to see you again.
Great to see you.
Right, so a recent poll shows a troubling rise in the number of people being affected psychologically by COVID-19.
Right, so we're talking about a survey by Job Korea and Albemarle. Sunny, stress levels and depression are on the rise among Koreans, saying with 8 in 10 respondents saying they experienced angry or depressive moods due to the coronavirus. Now, some 1,200 university students and employees in the labor force took part in the survey, with 84% of them reporting changes in their emotional state amid the pandemic. Of them, more than 65% said they had symptoms of the so-called quote-unquote coronavirus blues, referring to a sense of depression and lethargy due to social distancing restrictions and isolation. Dr. Ha Ji-yeon of Konkuk University Medical Center pointed out that those in their 20s in particular are socially active and need to enter the workforce, but almost 2 years have passed and many of them haven't been able to get off the ground. Meanwhile, more than 14% of the respondents also said they felt a sense of uncontrollable anger and irritation, while more than 20%, or 1 in 5 adults, said they were losing interest in life due to a sense of despair and hopelessness. All in all, the majority of people in the survey said the drawn-out pandemic has had had a negative impact on the quality of their overall lives.
Right, Song-yeon. And I understand that quite a number of public servants, women in particular, are bearing the brunt of the psychological toll.
That's correct, Sunny. So a study was released just on Thursday showing that public servants involved in containment efforts, specifically, especially women, married people, or those with little work experience, are reporting high levels of stress and anxiety. The researchers said these groups may have felt they had more to lose from being infected with the coronavirus and were more sensitive to even minor physical symptoms. The team also noted that married people had more stress factors to deal with compared to their unmarried counterparts over concerns on the well-being of their family members and children. In the meantime, another survey also showed that many employees working at call centers have been suffering from depression as well. In fact, 8 in 10 were categorized as high-risk individuals, and for some, it's even led to heartbreaking consequences.
I'm trying to be stress-free, but it's hard to do that when you're pregnant. I ended up having a miscarriage in January earlier this year.
Now, many of these employees also reported that they barely had time to rest on weekdays due to their growing work burden amid the prolonged pandemic. According to a survey by the Public Traffic Service Workers Union, it was found that some 35% of employees did not have time to take even a 10-minute break during their day.
Right, Song-yeon, hang on. We're talking about a 10-minute break during the day.
Yes, it's quite disturbing, isn't it?
Right then, well, what are some practical ways then to better address this really troubling mental challenge of COVID-19?
Well, Sunny, health experts, they did have a number of recommendations, and one of the most important advice is building resilience to ward off stress and anxiety. So from a psychological standpoint, resilience refers to one's ability to return to normal routines after experiencing shock from a negative event. According to survey results, it turned out that those with a high level of psychological resilience were less likely to report stress or anxiety following a profound event, in this case, the COVID-19 pandemic. Now, experts also advise people with depressive symptoms to stick to the basics, such as getting a good night's sleep and eating 3 regular meals a day, and above all, taking the time to go outside and get some sun at least once a day to help keep your mind healthy and sound.
I see. All right, Song-yeon, as always, thank you very much for the coverage.
Thank you for having me.
Staying on the local front, authorities are pledging greater proactive efforts to address a potential surge in COVID-19 cases in the coming days, especially in light of Friday's record daily tally, which our Swa touched upon earlier on. Right, Soa?
Right, Sunny, a very concerning situation there.
Right, so let's start then with the government's remarks with regard to Korea's fresh high on this Friday.
All right, so let's start off with the Prime Minister's remarks earlier this morning as he expressed concerns on the critical situation. And he stressed that containment measures will be extremely important up until next week, because that's when the effect of mass movement during the Chuseok holidays are expected to reflect in the numbers next week. So let's take a listen to his message.
Many experts forecasted an increase in cases with the rise in movement. Nevertheless, the spread is astonishing, and it's also regretful that we couldn't prevent such a scenario from happening in the first place. I ask health authorities and local governments to thoroughly inspect containment measures that may have become lax due to the holidays and exert all their efforts to swiftly identify cases through an expansion of testing and strengthened contact tracing.
Right, so and speaking of expanding testings, there has been a tangible rise in the number of those tests here in the capital city, right?
Right, Sunny. On the 23rd, so yesterday, just a day after the Chuseok holidays, over 110,000 people have been tested for COVID-19 in the capital alone. And so that is higher than around 90,000 tests that were conducted on the 30th last month. So we are maybe even going to see over 1,000 cases in the capital Seoul by tomorrow tomorrow because we already had over 900 this Friday. So it is good to see cooperation from the nation's citizens, but the results are also showing these high figures and concerning forecasts. Now, according to an official at the earlier government briefing, Lee Gi-il, the number seems to be rising as people from the metropolitan region have returned from the Chuseok holidays and then are getting tested. So as I said, with that, the official is expecting a higher number by tomorrow on Saturday, and even next week there could be another surge because that's when the numbers could go up once more when the test results of more people who returned from their hometowns are reflected. Now, the government, meanwhile, decided to extend operations of a number of temporary test centers that have been installed for the Chuseok holiday period in preparation for a potential worsening situation in the coming weeks. Makeshift test centers at major traffic hubs such as expressway rest areas will be open until the end of October for citizens to conveniently use them on their way home from long weekends as more holidays are coming up. Over the span of 39 days, almost 100,000 tests were conducted at such test sites, with 353 people having tested positive for COVID-19. 73% of those were asymptomatic patients. Over the Chuseok holidays, 17% of patients were confirmed at these sites, and they conducted 8.2% of all tests during that span.
Right, quite impressive. But how is our medical infrastructure coping with the recent caseloads?
Well, Sunny officials said today that at this point we have sufficient hospital beds across the nation for COVID-19 patients. And the government also announced today that it is going to expand home treatment as well. Now, Son Young-nae, another official at the briefing earlier, said a daily case count of more than 2,500 patients could put a strain on our medical capacity. But what's important right now is not only the number of daily infections, but also the vaccination rate counts as well. So even though we are seeing higher numbers now, the number of hospitalizations and people in critical situation is not going as much up as the number of daily infections when compared to before. And speaking of vaccination, to boost the vaccination effects further, Prime Minister Kim Boo-kyum had this message to the public.
18세 이상의 국민들 중
Additional vaccine bookings for 5.77 million people aged 18 and above who have yet to get their shots started a week ago. But the booking rate stands at just 2.7%. We need everyone's cooperation to quickly return to our daily lives. Please take active part in our vaccination campaign for the sake of your family, friends, and our community.
And Lee Gi-il backed the need for more vaccine cooperation with the following numbers.
According to the KDCA's analysis from the past 2 weeks, 89.8% of patients were either unvaccinated or only partially vaccinated. Vaccines are 77% effective in preventing serious illnesses and also lower the probability of death by 73.7%.
Which again is important, why we should be vaccinated, of course, then. All right, so as always, thank you very much for the detailed local coverage.
My pleasure.
On the international front, prospects are looking up on the global vaccine supply front as India looks to resume shipments abroad following a halt back in April. Ji Abili is here with more on that. Hello, Ji.
Hi, Sunny. As you know, India is the biggest maker of COVID-19 vaccines in the world, and this week it announced it would resume vaccine exports later this year. The country stopped the exports this spring to secure enough doses for its own citizens when the infection rate skyrocketed. On Thursday, U.S. Vice President Kamala Harris met India's Prime Minister Narendra Modi in Washington and welcomed the decision.
On COVID-19, our nations have worked together. Early in the pandemic, India was a vital source of vaccines for other countries. When India experienced a surge of COVID in the country, the United States was very proud to support India in its need and responsibility to vaccinate its people. And I welcome India's announcement that it will soon be able to resume vaccine exports.
Media reports say Harris and Modi are expected to discuss the COVID-19 pandemic, greater cooperation in technology, space, and other sectors. Modi's three-day Washington trip will be capped by a meeting with U.S. President Joe Biden at the White House on Friday. Biden and Modi will also hold a quote-unquote Quad summit with the leaders of Australia and Japan. The summit is aimed at strengthening cooperation in the Indo-Pacific region in the midst of China's growing influence in the region.
Right, and staying in the Americas, what's this I hear about a hospital offering untested coronavirus treatments?
Sounds really horrid, but it did happen. Health insurance company Prevent Senior admitted Wednesday that doctors at their hospital network administered untested COVID-19 treatments to patients in Brazil. The Brazilian Senate is investigating the health insurer after being handed a report that said the company is testing drugs such as hydroxychloroquine and more on COVID-19 patients without their authorization. In addition, the company has been accused of changing the diagnosis of COVID patients. The senators believe the diagnosis change could mean that patients who are admitted into a hospital with COVID and then died could have their death certificates changed to another cause of death. The company's CEO, Pedro Benedito Batista Jr., addressed a session of the Brazilian Parliamentary Inquiry Committee, or the CPI, that investigates government actions and management during the pandemic. In his defense, Batista Jr. singled out the behavior of the accused doctor.
The physician is the one who prescribes any medicine. At that time, as everyone remembers, there was even the pronouncement, not only the presidency of the republic, but of the other influential people and patients, demanding the prescription of the medicines.
Right, finger pointing in display right there. Jay, meanwhile, I believe you have time for one more story, is it?
That's correct. So this time, let's go over to neighboring Japan. Japan's upcoming ruling party election will ultimately decide the country's new leader to replace Prime Minister Yoshihide Suga, who is stepping down amid sinking approval ratings. The winner of the race to lead the Liberal Democratic Party, or the LDP, is almost certain to be the country's next premier because the party has a majority in the lower house. The election will take place on Wednesday, September 29th. There are four contenders. Vaccine Minister Taro Kono, 58, former Foreign Minister Fumio Kishida, 64, former Internal Affairs Minister from the party's most conservative wing, Sanae Takaichi, 60, as well as former Minister for Gender Equality, Seiko Noda, 61. Surveys of the voters show Kono is a top contender. Experts say this will be what voters are hoping to see.
I think the hardest task is to somehow strike the right balance that is convincing and supported by the people between restarting the economy on the one hand and taking sufficient measures to contain the coronavirus at the same time. And this is where the previous prime ministers, both Mr. Abe and Mr. Suga, have been seen as having failed.
So for the past year that Suga was in office, his main challenges were dealing with the coronavirus, of course, but also hosting the Tokyo 2020 Olympics and Paralympics in the state of emergency. That's all for me today. Have a safe weekend, Sunny.
All right, Jay, you too. Thank you for that. We now turn back to the local front for a look at government efforts to prop up the K-beauty industry in light of the fallout from the pandemic. For more, our Chun Song-cho is out on location. Song-cho, welcome back.
Good afternoon, Sunny.
Right, so you are at a venue right now that offers the chance to explore K-beauty, I hear.
Right, so I'm here in Myeongdong, heart of Seoul, what used to be considered the the Mecca, the epicenter of the beauty world, the K-beauty Mecca. This is where K-beauty enthusiasts would come to get their hands on the latest makeup and skincare products. But with the pandemic, the number of tourists went down, and so did the business here. I mean, outside, the streets look and feel almost empty now compared to how it used to be so busy before COVID. No more lines of people lining by street vendors, no more salespeople shouting about their discounts. I could even spot some stores vacated or closed here and there on the streets. So in order to help prop up the battered industry, which really contributes so much to the local economy, especially the small and medium-sized businesses, the South Korean government has launched a pilot project and set up a K-beauty center here in the heart of Myeongdong. So this center is all about beauty here. As you can see, there's a wide range of products here, from skincare products, of course. K-beauty is best known for their multiple-step skincare routine. And really, in order to test out these products, there are even cleansing rooms behind me where you can really wash off any products that are left on your skin to test out the products on your bare skin. And of course, here are cosmetics brands and products like lipsticks and eyeliners. And what's really interesting is that these are all small local brands that you've probably never heard of before. They're not multinational brands that you've heard of. So you'll be introduced to new products and brands here as well. And I want to tell you about this kiosk, which comes really handy at times like this in the middle of a pandemic when you feel uncomfortable making personal interactions with people. So this kiosk will give you an analysis of your personal colors. What does that mean? Well, it will give you a set of colors that look best on your face, depending on what type of skin you have, the undertone of your skin. So I'm going to pull off my mask just for a while here. Here's a color card, and I'm going to put my face right here so that the camera can pick up my undertone of my skin. So now it's checking. According to this kiosk, my seasonal color is fresh and gorgeous summer cool light. So more details here. So here are a set of colors that looks best on me. So I can apply these recommendations on what type of lipsticks I should wear, eyeshadows, or even clothes I wear. So here you can get even professionals' help here to see what type of skin you have and what kind of makeup looks best on your face. But remember the days when you would get temporary tattoos for parties and festivals? You can even get some here too, but in a really cool way. So, good afternoon.
Good afternoon.
Can you help me out with the temporary tattoo?
Sure.
Okay.
So we're going to start with spray out the skin primer.
Okay, so this is the primer to prime my skin for the temporary tattoo here. Okay, let it dry. So I see this really cool, interesting looking state-of-the-art machine, the equipment.
So we're going to put our logo on your skin.
Okay, so just to test it out, she's going to put a tattoo of the logo. What is this?
You need to open it first.
Okay. Wow! Did you see that? This is unlike the stickers that we are familiar with. This is so cool.
Yeah,
Thank you so much for the tattoo. Okay. Can I ask you more questions? So can you tell us about how this center came about? I mean, what's the primary objective of the center?
Beauty Play is designed to facilitate the globalization of small and medium-sized cosmetic companies' products. This is a space to display, experience, and promote K-beauty and cosmetic products, and is an open beauty experience space designed for domestic consumers and foreign tourists alike to enjoy K-beauty culture.
Okay, and it's been about 3 weeks since the center came about, and I'm sure you've been here to see the visitors' reactions. So how are people enjoying the center?
Very often, the first reaction of visitors is to get out their cell phones and take pictures. It's hard to imagine anyone coming here and not developing some new interest in K-beauty as a result of their experience and participation in our programs. We endeavor for everyone living us to feel informed, relaxed, and having enjoyed their time with us.
All right, thank you so much for your time this afternoon. Thank you. All right, so this center is trying really hard to make it a safe place from COVID-19, and that is why it's only available to those who have made online reservations beforehand. So you might want to check that out on their website before coming here to visit. And like I mentioned, this center is operating on a trial basis currently, and it will determine the official opening date in accordance to the country's social distancing scheme. This has been Chun Seung-Cho reporting live from Myeongdong, and back to Sunny in the studio.
All right, Seung-Cho, as always, thank you very much for that treat. And to our viewers here, we do apologize for the slight disruption in our video feed from Seung-Cho.
연휴 기간 동안 일용량 증가로 인해 그동안 다소 정체 상태를 보여주고 있었던 비수도권의 방역 상황도 다시 악화될 가능성이 있는 상황입니다.
It's been more than 80 days since Korea has been recording daily tallies in the 4 digits, and given fears about a possible post-Chuseok surge starting next week, we now explore the options available to better contain this relentless fourth wave. For more, I have Professor Kim Moon-gyu from Yonsei University. It's good to see you again, Professor Kim.
Good afternoon.
I also have Dr. KimSeungTaek from Institute Pasteur Korea. It's good to see you again, Dr. Kim.
Good afternoon.
Right, Professor Kim, the daily tally has been hovering at record levels during the 5-day Chuseok holiday, and we're ending the work week this week with the tally above 2,400. What are your thoughts on this unsettling reality?
Let's look back the Chuseok of 2020. We started Chuseok holidays with about 50 cases per day, and when the Chuseok holiday was finished in 2020, it was almost doubled. But it declined to the about 50 within a few days. So I think we passed through the Chuseok holiday very well in 2020. This year, we started about 2,000, and now we have a surge about 2,400, and it doesn't seem good. And I think the reason of this increase is that we're dealing with the Delta variant, which has a higher R number. And if you look at back history of Spanish flu, there was a Thanksgiving and Christmas holiday in 1918, and that big holiday resulted in a third outbreak. So that is the reason why we are so conscious, and we should be vigilant in this kind of holidays. And one good news is about half of our population is vaccinated, finished their vaccination, and still we have breakthrough infections, sometimes symptomatic, sometimes asymptomatic. And most of the vaccinees in Korea are within 6 months of the final vaccination. That is something hopeful, but still we have to keep on the efforts we had kept through these days.
Right. And we have to keep those efforts, as Professor Kim said, Dr. Kim, because transmissions within the metropolitan region appear to be quite severe. They account for over 70% of the daily tally nationwide. What is challenging containment efforts here in the Greater Seoul area, Dr. Kim?
Well, as Professor Kim said, currently we are actually dealing with the Delta variant, which is known to be just spread more efficiently compared to the other variants known so far. And then the basic reproduction number is now close to 1.08,
And then there are actually many the variables actually determine this number. And then one of the variable which determine this number is the human behavior. And in terms of just a surge in the metropolitan area, actually, obviously, just the metropolitan area is the most populated area in Korea. It's now just half of the Korean population just reside here within the very small just a surface area. This is about just more, a little over just 10%. So it's more just the populated area is now just more vulnerable to the just infection and the transmission. And then now just this metropolitan area compared to some of the rural area, there are more just young generations. This generation is typically more just socially active. So this might just expedite the more transmission in this capital area right now.
Right. Professor Kim, there are frightening forecasts of 3,000 to 4,000 daily cases come next week, given the repercussions of the Chuseok holiday travel. Do you share this outlook?
I was on duty during these Chuseok holidays, and we had to shut down our emergency department many times because we have confirmed cases. So we have to disinfect all the area to prevent further spread. And also there were many patients visiting our department because after the vaccination they feel chest pain and some other complaints, which was mostly not related to vaccine side effects. Well, that was the picture of Chuseok for me, this pandemic. And we see many outbreaks from marketplace, construction sites, hospitals, fitness center, even in the non-metropolitan areas. And people who are notified to be exposed to COVID-19 should have a test and keep strict social distancing even though they do not have any symptoms. And people who have fever or respiratory symptoms should not hesitate to go and get a test. Sad news is there are breakthrough infections even after vaccination. But still, we have a good news that viral load after the breakthrough infection is relatively lower compared to the people who are not vaccinated. And this effect declines after 6 months. And this might be the reason why the scholars are insisting for booster shots. I would like to look at the data of some Asian countries. And I think Chuseok, we have a similar holidays in Japan and China. And those two countries did not show any surge after this holiday. Even Taiwan, they keep the low incidence. But Singapore, they have a very high rising, rocket rising incidence right now. The vaccination rate is about 80% in Singapore. But I think they have a different strategy right now, just like to go through a live with the corona strategy. And that might be one reason they have a relatively increasing incidence right now. So view as a whole, I think it's going to decline after some surge in Korea right now with the efforts of social distancing, vaccination, and active testing.
Right. And going back to the breakthrough infections that Professor Kim mentioned, Dr. Kim, how do you explain this worrying trend of transmission, breakthrough infections here in the country?
Well, first of all, I have to emphasize again the vaccine currently that we are using right now was actually developed just to prevent the diseases, not the infection. So that's one thing that I have to say. And then it's not really surprising that the breakthrough infection number of breakthrough infections increases because our vaccination rate is also increasing. So that it's not really surprising that our vaccination rate increasing. So then we will see more cases of breakthrough infection. And then I think also the vaccinist people now they psychologically tend to be more just less careful because they say, well, now we are vaccinated. now we can just really just move around more freely. So that might just probably just contribute to some a little bit of an increase in the some breakthrough infection right now.
Because of human behavior.
Sure.
Right, and breakthrough infections are also being recorded over in the US, where relevant authorities are thus laying the groundwork for booster shots as they continue to battle the pandemic. For more, I have Professor Peter Chin-Hong at the University of California, San Francisco live on the line. It's a pleasure to have you with us again, Professor Chin-Hong.
Thanks for having me on, Sunny.
Right, Professor, let's begin with the worrying rise in fatality over in the US. I hear an average that is, of over 1,900 people have been losing their lives to COVID-19 in recent days. Please tell us more.
Yes, well, Sunny, the US is still unfortunately setting records and leading the world in burden of COVID, not only cases, but deaths. Things are kind of plateauing off right now, but the level is still very high. So more than 125,000 cases a day in the country. And like you mentioned, more than 2,000 deaths a day in the country. And this is really a complex landscape. It's like several different countries together, really, because different parts of the country have different vaccination rates and they have different politics. So some regions of the country promote mask mandates in schools, in public, others don't. And right now we're moving a little bit from the south and we're seeing more of the north affected with cases. So states like Wyoming and Idaho, Alaska, they're seeing new surges in cases, whereas the south is going down. But overall, plateauing, maybe going a little bit down, up and down like a sawtooth. And that's what we're seeing in the US.
I see. Professor Chin-Hong, following the FDA's green light for Pfizer booster shots for those aged 65 and older, as well as those with pre-existing health conditions and, of course, those who work in high-risk venues, an advisory panel of the CDC has recommended these third shots only for those aged 65 and above and those with medical conditions. What can you tell us about the background behind these stances on booster shots?
Well, Sunny, there is a disagreement right now between the FDA's Scientific Advisory Board and the CDC's advisory board called ACIP. The CDC met today, and the FDA had originally recommended booster shots for Pfizer in 3 groups: those over 65, those who have medical conditions like obesity or hypertension, diabetes, and those who, by their occupation, put them at risk for continued exposure, like healthcare workers, teachers, etc. The CDC took the FDA recommendations and only really focused on 2 of them, which are those over 65 and those with medical comorbidities, but not those who are at risk of continued exposure, like myself, like a healthcare worker. So I think this leads to a little bit of disagreement. I think the most important group, everybody agrees, is those over 65, because that's where the evidence is. Despite the Israeli data, right now in the US, if you are younger than 65, your chance of dying from breakthrough vaccinated COVID infection is less than 2 per million. So most of the deaths, most of the cases, we're still seeing in those over 65 and even older, and the deaths are those over 85 and immunocompromised individuals.
Professor Chin-Hong, what are your thoughts on the exclusion of healthcare workers from the booster shot list by the advisory panel of the CDC then?
I think it was a little bit surprising, but if you think about where the CDC is looking at, they're looking very critically, not just at the worldwide data, but what is the data in the US? What's the data in the American context? And there isn't a lot of breakthrough infections in younger healthcare workers, for example. I myself, being on the COVID wards for the last few weeks, I'm mainly seeing breakthrough infections being hospitalized in the elderly or the immunocompromised. And when you look at our data in the US, not a lot of healthcare workers or teachers or prison workers or those who are in congregate settings coming in who are younger.
I see. And meanwhile, back here in the studio, Professor Kim, what are your thoughts on the adoption of booster shots here on the local front?
For people who have high risk, like Professor Hong mentioned, high age, more than 65, cancer, obesity, diabetes, and immune compromise, definitely they're going to need a booster shot because there's a decline of immunity more prominent. For people without risk factors. I think it's not a matter of giving booster shot or not giving booster shot. I think it's a matter of when. I mean the timing, and when all the Koreans vaccinated for the second shot, and when there's enough evidence that is accumulated that we have a benefit from the booster shot. I think that will be the time that we can freely talk about giving booster shots. There is a reason that FDA did not approve the booster shot Pfizer yet, and we're going to have some time and accumulate the data, and then I think we can make an easy conclusion at the time.
Right. I hear you also have a small question. Is it a quick question for
Yes.
Professor
Yeah.
Chin Hong, Professor Kim?
Yes, Professor Hong, it is yet to make a decision whether Janssen booster shots, and they insist that the effectiveness is about 94%. What is your opinion about the emergency approval authorization for Janssen booster shots?
Well, Professor Kim, I think, first of all, I agree with you in terms of the eventual need probably for most people to get a booster, but there's no emergency for that. And with the J&J Janssen vaccine, there is, again, no emergency for the general population. Again, we're seeing about 80%, depending on the data series you look at, to more than 90% of severe disease hospitalizations and deaths being averted by one dose. However, J&J released a worldwide study of about 40,000 people comparing one shot to two shots. And it looks very, very promising, with one shot affording about 75% protection and two shots providing about 94% protection against serious disease hospitalizations and deaths. So right now, where do we stand in the US? J&J hasn't submitted the booster application yet to the FDA, so we can't give a J&J booster legally. But in certain jurisdictions like San Francisco, they're looking at the data, and they've actually offered people who are J&J recipients to go ahead and get an mRNA shot if they wanted to after consultation with their healthcare providers. I'm most worried about older individuals and those that are immune compromised with a J&J single shot, because I think there's less guidance for J&J individuals, even though they're in higher risk. I think individually, many healthcare providers are advising those in high-risk groups to go ahead and get a second shot. Right now, the only vaccine we can give off-label is really the Pfizer vaccine, because that's the one with full FDA approval in the United States.
I see. Meanwhile, Professor Chin Hong, I believe you have a question for our Dr. Kim here in the studio.
Yes, Dr. Kim. My question is around vaccination uptake. And as you know, 64% of Americans have received at least one dose of a vaccine. However, this vaccination rate has slowed down in the US considerably recently. I understand that 70% of Koreans received their first dose in just the past 204 days. Could you comment about why this effort is so successful in Korea, and why has it achieved such a rapid uptake so quickly?
Well, yeah, first of all, this is I think we actually expected. I mean, we were actually a little bit delayed in starting just vaccination, but we expected we will just soon catch up with the speed and the vaccination rate of other Western countries. Then, for example, we are very actually good at this kind of some public campaign. And then in the beginning, actually, some Korean people also just hesitated because of some side effects. And the side effects was actually just the main focus of many the mass media. But then there are somehow the people now realize that the people around them is mostly likely just neighbors and their friends now taking vaccine. So then that somehow stimulated those people to get vaccinated. And then I think there's some incentives for some the social gatherings, I think also worked as well.
Right. And Professor Chin Hong, before you go, a very quick question. What efforts are being made by authorities there in the US to boost public inoculation against COVID-19, given the slowdown that you mentioned?
Yeah, so we've tried all of the carrots. We tried ice cream and beer and a lot of incentives, lotteries. They didn't really work for about 30% of the population. Now the sticks are coming out. So President Biden, about 2 weeks ago, announced a mandate that affects probably 100 million Americans who work in small businesses and at the federal level, healthcare workers. They have to get vaccinated. And I think that those sticks will ultimately be the solution. The mandates will be the solution. The school requirements will be the solution of the future.
Right. All right, Professor Chin Hong, as always, thank you very much for your thoughts today. Dr. Kim here in the studio, thank you for being with us. And Professor Kim, as always, it's been very insightful. Thank you.
Thank you.
Right, well, do seek to abide by all safety precautions, even after inoculation, to ensure protection against breakthrough infections. Thank you for watching. Have a safe weekend.